So the topic is hyperhidrosis of palms and soles. What is hyperhidrosis? So hyperhidrosis is an excessive abnormal sweating of palms and soles which is not related to heat or exercise or any kind of anxiety. So you may drip as much, or you may precipitate sweat as much that the sweat drips off from your hands, and it causes social embarrassment and it causes a lot of anxiety among the people. So what causes sweating? Normally when a body senses high temperature, the nervous system triggers the sweat glands and we sweat. Now there are two conditions where there are two different types of hyperhidrosis. One is primarily where you sweat, when you sweat, excessive sweating happens, but there is no such condition like high temperature or any physical activity or any anxiety. So most commonly we see this kind of hyperhidrosis. The another one is secondary hyperhidrosis, where there is some reason, like if somebody is suffering from hyperthyroidism or some kind of menopausal flushes happens, or normally after some anxiety or any other cancers or medications can equally give hyperhidrosis. But most common form of hyperhidrosis which happens in palms and soles is essential hyperhidrosis, where there is no definite reason for excessive sweating. So what are the consequences of this excessive sweating? So it really causes embarrassment, it disturbs your social activity, social life. You are not able to shake hands, you are not able to hold the pen, you are not able to drive comfortably. So apart from that, it even ruins your romance, your physical activities are really halted. So there is a lot of consequences because of this hyperhidrosis. Even it complicates your business and it can stain your clothes. Now, what are the treatment options we have for hyperhidrosis? And today we are going to talk about the role of botulinum toxin, the Botox, which is commonly people talk about in hyperhidrosis. So when all the medical management fails, like there are a lot of antiperspirant lotions or kind of stuff which we use, creams in form of lotions on palms and soles, when you are not able to get any results from that, or a person is not fit for a surgery or doesn't want to go ahead for the surgery, and then the role of Botox is there. There's a role of Botox. So Botox is actually a US FDA approved treatment for hyperhidrosis of palms, soles, or even the underarms. So how do we do it and how effective is it? So basically a patient walks in and we do the counseling for that, and we test the patient's hands, measure the sweating, the extent of sweating the patient is having. Then we plan approximately 50 units of Botox on each hand. And the first we do on the non-dominant hand and then we do on the dominant hand. And it is done under local anesthesia. There is a little bit of uncomfortable, it could be a procedure, but it's not that painful. Approximately on the palms, we plan say around 20 to 50 points where we give around 1 to 2 units of Botox. Now the question is asked many times from my patients that how long it lasts and how effective it is. So it is really effective. The studies has shown that it is approximately 80 to 90% effective in reducing the content of sweating. And it lasts for around 6 months. However, if you do it again, like if you repeat the procedure after 6 months, and it can shrink the glands and you can get good results, and the results last for a couple of years. So this is about hyperhidrosis, and this is about the role of botulinum toxin, the Botox, in hyperhidrosis. So please do feel comfortable in consulting a physician or dermatologist who is really good in managing hyperhidrosis of palms and soles with botulinum toxin. Thank you. I hope this would have been quite informative. A video for you to understand the role of Botox or botulinum toxin in the management of hyperhidrosis, the excessive sweating of palms and soles. Thank you.